Awesome. Thank you guys so much for joining today. Before we get started, I just wanted to go over a few housekeeping things. So on the bottom right hand of your screen, you're going to see a questions tab and a chat tab. Please keep all of your questions in the questions tab and all of your chat in the chat tab. We are going to have a Q&A session after this presentation to go over all of your questions. And then there's also going to be a handout under the apps tab that you'll see with all of Tabitha's services. And then a recording of this webinar will be emailed to you after the end of the session. So now I would love to take a minute to introduce the woman of the hour, Tabitha. So Tabitha has been a social worker for 15 years and has owned her own group mental health practice for 10. She discovered IntakeQ while running her practice and has been using it for the past 4 years. In addition to her mental health practice, Tabitha has owned 2 other successful businesses, one being Ember Strategic Business Consulting, where she provides business coaching along with PracticeQ Setup. Her combined experience as a therapist and business owner gives her a unique perspective to help others achieve fulfillment and success within their own businesses. So today, Tabitha will share her insights that have saved her countless hours and significantly reduced costs, aiming to help everyone here unlock the benefits of PracticeQ's automations. So Tabitha, if you want to take it away, we can go through our agenda.
Awesome. Thank you everyone so much for coming. I'm super excited to share these things with you. As Abby said, they have saved me so much time and so much money. And I just love IntakeQ. I didn't know it was possible to love an EHR, but I really do. So we're going to go over setting up the billing type on your intake forms, how to create bulk claims so that you can create claims and send them to your clearinghouse in the same amount of time it takes you to do one claim. It will take you to do 3,000 claims, or however many in between. I want to show you how to do auto invoicing so your patients can be charged automatically. I want to talk about how invoices can get set up, get automatically updated when ERAs come back from your insurance, show you some ways to track your patient's progress, and show you some of the customizations of appointment reminders. So with that, I want to start by going over billing types. So your intake form really is the foundation for every other form you create in IntakeQ. So getting this form right is super important. And there's a lot of clinical reasons for that, but today we're just going to focus on the billing reasons. So in your intake form, if you are a practice who takes multiple types of payments, so in this case, insurance and self-pay or something else, a grant, you want to make sure that you have a question on your form that asks how your patient is going to pay for services. This can be as general, this is just a sample form of private Medicare, Medicaid, or it can be more specific to certain kinds of insurances that you have. So Blue Cross Blue Shield, Aetna, Cigna, it can be as specific or as general as you want, but the reason you want to have this question is because in your form, there's the rule settings. And what the rule settings do is they will set the billing type in your client profile, which I'm going to show you on the next screen. And I'm going to explain to you why that's so important. So this is a form for my practice. These are the kinds of insurances that we take. So I have my form set to ask, what is your primary insurance? My clients choose what their primary insurance is, or if they're self-pay or sliding scale. And when they choose an insurance option, it sets the client billing type to insurance. And if they choose self-pay, it sets the client billing type to self-pay. Now, this looks like this in your client overview. So this is, again, another patient, a sample patient. So this billing type here is super important. You want to make sure that this is correctly says self-pay or correctly says insurance type. And again, we're doing that by making sure there's a question on the intake form, and then we have the rules set up in the form so that when a patient clicks on insurance or self-pay, it appropriately determines if it's self-pay or insurance here in the system, here in their overview. Just as a little side note, that rule setting with your billing type, you can also do things like set a tag to come up on your patient's chart that says what kind of insurance they have. We have an option, we have a grant that we work through at my practice. And so we have a tag automatically that gets created that says they're a part of that grant. And you can do that tag trick with really any question, but it can be really helpful on the billing question, the billing type as well. So we've got our form set up correctly, we've got our rules set up correctly, and we've double checked and made sure that it is populating correctly in the patient's overview. The next thing you want to make sure you do when you're taking pre-screening your patients or determining what their benefits are, you want to make sure that you have this information accurate. This is again in the patient's overview, so it's right underneath this section here. You want to make sure that patient's insurance information, if they have insurance, is accurate. So the insurance company name, the policy number, their copay, and any deductibles, because this system is going to pull from this information. So these few areas are extremely important and set the stage for all the other things I'm about to show you. So the fun things you can do when you have this set up correctly. So just to review, you're able to do bulk claim creation, ensuring that your self-pay and your insurance patients are getting accurate charges on their invoices. And it also sets the stage so you have accurate reporting, and there's so many different reports you can pull to make sure that you haven't missed charging anyone, if there aren't any outstanding claims, et cetera, et cetera. So it's super important to make sure that your other reports are accurate. So I want to show you how easy it is to create bulk claims. I came across this winter. My practice manager was out, and her job was like 95% billing and invoicing. That was the majority of what she did. She got COVID, and I was like, oh, I have to do the billing and invoicing. This is so annoying. I don't have time for this. It's the week of Christmas. And I'm like, surely there has to be a faster way. And in full disclosure, I had not been keeping up with the different updates that IntakeQ does. So if you're not on their email list to get those updates, I highly recommend that you get on it, because they do updates all the time. And I could have saved myself a lot of time and money a lot sooner if I had been getting those updates and I'd been keeping track of them. So my practice manager was out, and I stumbled across, I'm like, there has to be a faster way to create claims and invoices. So I stumbled across this amazing feature. Let me just pop in here to my IntakeQ. So in order to do bulk claims, as you may know, if you want to do a single claim, you can just go to the no and go to create claim. Sorry, that's create claim. If you want to do a bulk claim creation, you just go to lists, claims, create claims, and then you can choose, this just has, as a sample account, just has one practitioner, but you could choose all your practitioners. That's what we do. You can choose just one day. If you bill once a week, you can do it for a week. You can do the lifetime of the practice, whatever you want. You do want to make sure that this is chosen, insured clients only. And if you just want to bill for a certain payer, you can do that. If you want to bill for all of your payers, you can do that. You hit search. You're going to get a lot of error messages because, again, this is a sample account. This won't typically be here. You're just going to click here and say create claims. And what this is going to do for you, so you're going to say yes, validate claims. It's going to tell you if there's stuff missing, if there's a diagnosis missing, if there's a CPT code missing. It's going to show you all of that. So because this is a test account, there are some claims that are missing information, and there are some that are fine. So you'll see they're listed in draft. So I'm going to now go here to bulk actions, and I'm going to submit to clearinghouse. And my claims have been submitted. That fast, that easy. So I accidentally automated my practice manager out of a job. And because of that, she's actually been able to do a lot of other things for me that help to grow and build the business. So I'm not spending 35 hours a week paying her to create claims. I'm paying her to do a lot of other things. And on the back end, she reviews our ERAs and things like that. But the process of creating claims, things aren't missed. We know very clearly if claims have been created and billed. When we go to create the claims, it'll show us if there are some stuck in draft for some reason, like if you have to get an off for it, you can go back in and put that later. But this process is so fast and so easy, and it cuts down on so much admin time and making sure you're not missing billing claims. All right. So that's bulk claim creation. Now I want to go over automatically invoicing your clients or your patients. So this is a great feature that is helpful for self-pay as well as insurance patients. If you remember, we were at that one screen where you put in your insurance, patient insurance information. That's how you make sure that the system pulls their copay versus the whole self-pay amount. So for us, we require a credit card when booking. You don't have to. And then this is where you can change your process. So you have the ability to have the system automatically charge your patients their copay, again, whether it's self-pay or sliding scale, or self-pay or insurance, at whatever interval you want. Some practices do it the day before the appointment. Some practices do it the day of, an hour before. I do it 3 hours after the appointment because I want to make sure that my clinicians have enough time to go in and mark an appointment as missed or canceled if they didn't get to do it. That way we don't have to refund people. But you can have it charge, the system charge automatically at any interval that you want. And then this is a great, as you see here, charge 8 hours before. You can change this to after. This is also a great feature when your card is not on file or when the auto charge fails. We have the option chosen that says to send the patient a notification. And my practice manager also gets a notification, which starts a process for her of reaching out to the patient and saying, hey, your credit card didn't process, please fill out the form that was sent to you so we can process your credit card and keep your appointments. So this is another super helpful feature of a notification, which just automates the process even further for your admin staff or for you if you're a single practitioner. All right, this is my favorite feature of all. So I just want to say that one of the things I love about PracticeQ so much is their customer service. I know they've grown a lot. I know sometimes people get frustrated because it's just email customer service, but they really, really listen to their customers and they're constantly improving things. And this came out of a conversation that I had, probably about a year ago. I think it was with Tyson, about my frustration with how cumbersome keeping up with invoices was for our admin staff. I mean, she was spending so much time editing invoices, sending them out again, issuing refunds, comparing it against ERAs. So automatic invoice updates. If you are an insurance-based practice, listen up because this is going to change your life. So the way the system is set up, you have the choice to do this or not. If you don't want it to be automated, it doesn't have to be. But you have the option that when you bill a claim to an insurance company, when the ERA comes back, if there's a discrepancy between what the patient paid and what the insurance company says they owe, the system will automatically update it for you. So for example, you have a patient, insurance told you they owed a $20 copay. They paid that, the invoice was automatically created, their charge was automatic, or their card was automatically charged, and the ERA comes back a month later and says, just kidding, they owe you $40. You can set the system up so it automatically updates that invoice to show that the patient owes $20, and it automatically sends that invoice to the patient to pay that fee. The reverse is also true. If the insurance company says you owe $20, you bill the insurance, the ERA comes back and it says, just kidding, this patient doesn't owe any money, you can set it up to automatically credit the patient's account and update the invoice to show $0. I can't express to you how much time and human error was saved with this update. It is super, super helpful because you don't even have to think about it when your biller or your admin is going through your ERAs. They don't have to cross-reference every single claim with every single invoice. They just have to look for claims that were denied or incorrectly sent to deductible. So it just saves so much time. And then they're not having to go in and manually update invoices and manually send them to patients and track patients down. I think that's pretty much all the things that saves you, auto updates. And I wanted to just go over a few less dramatic things, but still extremely helpful things. So what's super helpful is you can have certain forms be attached to certain appointment types. So this is our intake, our psychosocial at my practice. And this is our new patient intake that we send patients. So we have it set up to automatically, when my admin goes in to schedule a patient, she puts in their name, she chooses the service type, and then this form automatically populates and goes out to the patient. it doesn't seem like much, but it does save time. Again, it reduces human error, and it does save time of your admin going through, which form do I need to send them? Okay, let me scroll. It just automatically, so she types in their name, chooses a service type, save, and it's done. So this is also helpful for tracking patient progress. So I have a mental health practice, so this is a mental health example, but for those of you that have different kinds of practices, this is really helpful for any kind of tracking that you have your patients doing, tracking of symptoms or progress, whatever those forms look like. And I didn't do an in-depth deep dive in here on how to create forms that can be tracked and can be graphed, but that's a whole nother feature that IntakeQ has. So the PHQ-9 is a depression screening that's very commonly used in mental health and primary care practices. So you can have it set up so that every single time your patient comes in for a follow-up, they get this form or whatever form you want them to do. Some of my clients I work with at my coaching practice, they have their own treatment update form that they've created, and they send that to their patients every single time they're seen. The other way you can do it is to create it as a journal. And this is per patient. So in this situation, this is going to go to every single patient that has this kind of appointment every single time. In this situation, you can do this per patient. So the practitioner can go into the patient's chart and choose create journal, choose which journal they want to send, and they can choose how often, how many they want them to submit and how often. It can be every month, once a week, once a year, once a quarter. And then you would send the journal. So just this specific client would get those updates. And this is great too if you want to have a patient fill out multiple forms. So this is a depression screening. Perhaps you want them to do a depression screening and an anxiety screening, or an anxiety and a depression and a substance abuse screening. And what's cool is if you have these forms set up correctly, you can have them, if you choose, to automatically pull into your treatment note. So when you pull up that treatment note to document your visit with your patient, it automatically has that information in there, and all you have to do is just glance over it, review it with the patient verbally, but you don't have to do anything extra with that, that evaluation. So that's a super fun tip. And then I don't have a ton of data on this sample, but there's a chart in the patient's overview that you can go to track their progress. So again, this is using a PHQ-9, a depression screening, but you could create whatever screenings you want, standardized ones or ones that you just make up. And then you can have a graph of the patient's progress over time, which is super helpful if you're looking at like medications that were prescribed and how they impacted the patient, in a variety of different situations. It's helpful to have a very clear graph and to show your patient, like, look how much better you're doing. Or like, oh, we went off that medicine and I kind of was concerned that maybe it wasn't going to go so well, and it looks like it might not be going well. What are your thoughts? So it's a great way to collaborate with your patients too and show them progress or lack thereof. Okay. So, and this is kind of the last thing I want to go over, and it's pretty basic in terms of most systems have appointment reminders. I think what makes PracticeQ different is the amount of reminders and the way they can be customized. So I've worked with some practices that have extremely complex appointment reminders, like every different practitioner and every different appointment type has a different appointment reminder. You can see just some of the options of email templates that you can do. I like using this scheduled email template. When we have new patients come in, we send them a reminder 3 days before their appointment time to fill out their paperwork, and just remind them if we don't get it back, we'll have to cancel their appointment. But the way that these are set up to just be super customized you can do it per location, you can do it per service, per provider, certain providers with certain locations and certain service types. So it's completely customizable. And this is just the email reminders. There is also a texting reminder as well, which I don't know. Yeah, I didn't include that in here. But there is also a texting reminder that are less customizable. The emails are the most customizable, and they're the longest, and you can give the most information because you don't want to pay for, a 3,000 character text message. That would be a lot and not money saving. Yeah, so I think that's pretty much it on the top time and money saving tips. So I offer business consulting, so it's kind of two different sides. If you're someone who wants some help and support around starting a business, scaling your business, hiring employees, hiring middle managers, learning how to build a better team culture, how to manage employees more effectively. I love working with people about that stuff, creating more effective systems. And then the IntakeQ side is helping people set up their systems to be the most efficient that they can be, making sure your forms are set up, the back end is set up. So there's a couple ways I'm doing that. I do have a couple of trainings coming up. I'm going to do group trainings specifically for mental health practitioners, whether you're a therapist or prescriber. In a group format just to kind of save costs. It is a week-long training. It's 26 hours of training that will be done in a group format. And it's going to be really good for people who kind of want to do a little bit yourself, but you need a little bit of help. It's going to give you the skeleton of what you need to do, and then you would go on and do it yourself. So this is great for somebody who doesn't mind technology, feels confident they can learn the system, and they just need some guidance in where to go. I would look into doing that, the PracticeQ intensive training. If you are someone who's like, listen, I'm totally overwhelmed, this isn't my thing, I don't even want to understand this system, please help me. You're probably looking at doing individual coaching that I can help with setting up your system. I have a number of clients right now that I meet with individually, and we just go through their system, line by line, point by point, to make sure everything's exactly the way they want it, that it's as efficient as possible. And then I'm going to be starting group coaching as well for people, both on the business development side and also on the IntakeQ build out side. So feel free to reach out to me if you have any questions or I can help in any way. The first training is going to be the last week of July. So if you're interested, please definitely sign up. And then there's one in August and September as well.
Awesome. Thanks so much, Tabitha. So if you would like to contact Tabitha, this is all of her contact information. You can email her, you can visit her website, her phone number as well, but I'm sure she doesn't want her phone line being blown up. So yeah, these are all of our services. Awesome. Well, great. I think that concludes the end of our webinar. So thank you so much, Tabitha, for joining us. We love to hear about all of your knowledgeable experience with your appointments and all of your automation. So it's been lovely having you. And for everyone else, thank you so much for joining us, and we hope to see you again soon.